So what we're going to talk about is mortality in kids. So give it just a second here to pop up. So what we're talking about is mortality and morbidity in kids. And so the idea of this is about getting kind of diligent in your assessment, because there's something that occurs in kids that has a high rate of mortality and morbidity that we don't do a very good job in assessing, and we don't do a very good job of putting on a differential diagnosis list. So the first question is, what do you think is the leading cause of mortality and morbidity in kids? Now, it's not, in this case, trauma, right? Which is the leading cause of death, right? But let's talk about leading cause of mortality and morbidity in kids. What do we think? You're close. What do you think?
Shock.
So, good answer. Not the right one, but I like that. Shock. I think everyone dies from shock, but keep going. I'm not going to give away. What's that? Poison? Nope. Good question, or good answer though. Keep throwing out more diagnoses. Not drowning. We're going to talk about that next.
Stupid parents with loaded guns in the house.
Yeah, not on the trauma side, yes, right? So it occurs in lots of people, not just kids. Okay? 6 million kids die from it worldwide. Yeah, closer. 50,000 cases occur every year. Every year since 1995, it raises by, what's that? Nope. Raises by 13%. 2 out of 3 cases die. All infants are the susceptible age group, and infants are the susceptible age group. Not flu. No. Just kidding. Nope. You've given me most of the signs and symptoms of it. Diarrhea, fever, what?
Dehydration?
No, no.
We're trying to
Sepsis, right? Believe it or not. Isn't that weird? We think sepsis and geriatrics. The funny thing, if I said geriatrics, this many died, even like sepsis. Why kids? How in the hell do kids get sepsis? How do they die of sepsis? Sepsis is from like crappy, weak immune systems that old people have, right? They have the same crappy, young, uninoculated systems as geriatrics, right? Now, what's interesting is when they started looking at diagnoses, they took 200 EMS providers, 83% of them paramedics, and gave them 4 sepsis scenarios, and only 10% of them got it correct. Which just tells you we're really, really bad at this. Now think about that. Only 10% of them caught the 50,000 cases that occur every year, and 2 out of 3 of those cases die. Seems like a lot of kids that we are misdiagnosing. And what do we misdiagnose them as? The flu, right? They're just sick. Fever. We think about the febrile seizure, but we forget what was the cause of the seizure in the first place. Now, the downfall is the treatment for this doesn't really exist in the pre-hospital setting, and it definitely doesn't exist at the EMT level, right? So that should tell you what's your goal, what is your treatment, quote unquote. Let them go. They need antibiotics, just like adults, right? But in the pre-hospital side, we really can't do that, right? I don't know about some protocols might allow medics to give antibiotics in the field on the civilian side, stuff like that, but you're right, they need aggressive antibiotic treatment. Fluid would be of importance because that fluid shift, you got to be given, they're dehydrated, but they already have fluid in too many places anyway, so it's almost like a catch-22. They need fluid, but not that much fluid. Okay? So the article that I read for this is what they're talking about. Is there's two ABCs of sepsis. First off, right now, before you get the sepsis call, there's the left ABCs. Acquire the knowledge, be ready to alert an ER, and make sure you're the advocate for that child. Do a good assessment, be aggressive, and get it treated. Then there's the, okay, what happens, or how do we recognize sepsis in our patients? Well, that's the right-sided three ABCs, and these are your three red flags, okay? First thing is, your patient has to have acquired an infection, right? So, are they febrile? Are they hypothermic? Nausea, vomiting, sores, injuries? Have they already been on antibiotics, right? And the last magic question that we now probably should start asking is, have they had any of the recommended vaccinations for diseases withheld, right? Don't get into the fight of why or why not or what it causes or whatever. Just ask them, are they vaccinated like their doctor recommends? No. Okay. Yes. Okay. Make sense? Are you up to date? Are we good to go? Okay? High-risk patients, AIDS, developmental delay, sickle cell, cystic fibrosis, cancer, premature delivery, poor respiratory dysfunction, poor cardiac reserves, liver splenic dysfunction, recent surgery, indwelling devices, transport organs, or and B or T cell deficiency. Okay? Now, half the some of us are like, what? If the parent tells you it, good. Then research it later to find out what it actually is. So here's the B, right? So they have the possibility of an infection. They got an infection. They've already acquired it. So they have a source. Now, do we have any blood vessel compromise? Here's how you can tell. Altered level of consciousness. Less than 12 or a drop in more than 3 during your care. Significantly increase or decrease heart rate. That's helpful. Significantly decreased blood pressure. What's their normal blood pressure? A 3-year-old kid, what's their normal systolic? 80 or 90. Right? So you're telling me significantly decreased. How many of you ever heard a systolic blood pressure like 60 in a stethoscope? Me neither. You can almost not hear it, right? We're talking about so faint and so quiet and so far down on the needle you don't even know it went that far. Okay? MAP, mean arterial pressure. This is a whole calculation. You don't need to worry about that, but the article talks about it for the paramedic side. Okay? I can't remember the number. I think it's 2 times the diastolic. I have to look at it for sure. 2 times the diastolic, and I think it's divided by the systolic, or there's a whole formula to figure out what is the mean arterial pressure. Okay? SpO2, less than 94%. Temperature, anything over 100 or less than 96 degrees. Hypothermic. And a glucose of above 108. These are your signs and symptoms. Okay? A long list. Circulatory compromise. Okay? Blood pressure less than 90. MAP of less than 65. Glucose, now on the other side, glucose of less than 120. These patients have, right, once we've got this far, these patients have what's called multiple organ dysfunction syndrome, or MODS, which means 2 or more of your critical organs fail. Okay? Oh, look at this. There it is. 2 times the systolic BP plus the systolic BP, then divided by 3. That's actually, I forgot to put the formula in there. Right? It's considered to be superior in assessing our patients. It's really good to know because a normal, believe it or not, a normal MAP is about 65. That's about a blood pressure of 70 systolic. Believe it or not, 70 systolic perfuses your brain perfectly. And that's all we really care about, right? Remember how I was saying we're looking at changing the shock guidelines? That's the reason why. We realize your MAP can be much, much lower. Right? 100 over 70, a MAP is 80. Okay? Mean arterial pressure of 80. Okay? Now, instead of like going through the whole process, it's really pretty straightforward. We're so bad at diagnosing this. Here's what I want you to do. If you have a kid that has an infection that appears sick, I want sepsis on your differential diagnosis list. Pretty easy. Treat for it. The nice thing is, you as an EMT, what's your treatment for sepsis? Take them to a hospital. Oxygen, help with their body temperature, supine or recovery, I don't care. Transport to the hospital. Make sense? It's why not throw it up there when your treatment, it's not like you're doing something super aggressive that has any contraindications or any problems associated with it. Okay? Calling in the field, altered level of consciousness, a body temp over 101.3, 96.5. Again, a little bit different numbers we just talked about, but these are your big red flags. Right? CDC says a temperature is not considered to be hyperthermic until it's 101.5 or higher. Okay? Heart rate, unexplained tachycardia of over 100. What's the problem with that? What's that 3-year-old kid's normal heart rate? Over 100. Right? Unexplained tachypnea. Breathing rate of over 22 times a minute. What's that 9-month-old baby's normal respiratory rate? 70? Right? A diastolic or a systolic of less than 100. Well, here's the problem. What's their normal blood pressure? Less than 100. Right? So we got to be aggressive. That's why we miss these, is because their vitals are already so skewed to one side. Make sense? Questions on sepsis? This one's really short. Got to treat it early.